Hello, I'm Richard Wellman, and I'm one of the originators of the 5-step method. So the aim of this short video is to both give you an overview of the core counselling competencies that a trained 5-step method practitioner should use throughout their delivery of a whole intervention, and to discuss some of the common areas of good practice that we've seen, and also some of the challenges and pitfalls that we've also seen, with some ideas as to how they can be overcome. So the core counselling competencies will already be familiar to many people who train to use the 5-step method, because they both align very closely with core counselling skills and are similar to and influenced by motivational interviewing. But of course, some people who train to become 5-step method practitioners do not come from a professional counselling background. For example, they may be affected family members themselves working within a voluntary organisation. And even for those who are already familiar with these competencies, it's very valuable to reiterate them here. And we cannot emphasize enough the importance of using all of these core counselling competencies within every session of the 5-step method intervention, and of the particular ways in which these competencies should be applied to fit in the best way possible with the stress, strain, coping support model. And remember, we're using these competencies to ensure that the practitioner remains in control of the process of the intervention, and use them also to ensure that the family member remains in control of the content of what is actually talked about. It's important to understand that these core counselling competencies are separate to the 5-step method competencies. A good delivery of the 5-step method involves a practitioner being highly competent in 2 sets of skills. One related to understanding each of the steps and what the various competencies are in order to deliver that step to a high standard. And then also another set of skills relating to how to engage with and draw out someone with whom one is working, in this case, an affected family member. When we ask practitioners to assess themselves to see if they're practicing competently, and when we assess practitioners for accreditation, we aim to assess a practitioner's competence both in delivering the different and specific areas related to each of the 5 steps, and in interacting with the affected family member in a high quality way, demonstrating high levels of the range of skills that we know are important to ensure effective therapeutic engagement. We have separate videos looking at the competencies needed for each of the 5 steps. And this video is about the competencies needed to deliver effective counselling. There's a key principle to the core counselling competencies that we ask practitioners to consider when delivering the 5-step method, and which underpins our assessments of those who are applying to become accredited 5-step method practitioners. And that key principle is, has the practitioner demonstrated enough competence in the application of these core skills? To answer this question, the following additional 3 questions can be considered. First, would I want to attend a counselling session with this person? Second, did the practitioner create the conditions in the session that allowed the affected family member to explore the issues? And third, was there evidence from what the family members said that they felt that this was a positive session and would come back for further sessions? Our basic stance is that if we can answer yes to these 3 questions, then it's clear that the practitioner has demonstrated sufficient competence in the counselling part of the 5-step method. It's quite possible for a practitioner to be assessed very highly on these core counselling competencies, but still do poorly on one or more of the 5-step method step competencies, and equally possible for someone to fulfill all of the 5-step method step competencies, but still do poorly on how well they demonstrate their core counselling competence. We've based our core counselling competencies on the best evidence available about how people use themselves to help other people to either change or feel better about themselves, arguably the 2 main aims of counselling. In 1956, a psychologist named Carl Rogers published a paper which effectively changed everything. That paper argued that there were simply 3 factors which a client needed to experience in order for therapy to work. Rogers argued that these 3 factors were necessary. If any were not there, then counselling wouldn't work. And he also argued that these 3 factors were sufficient, that if all three were there, then that was enough to lead to positive therapeutic change. These three factors were later simplified into warmth, empathy, and genuineness. That is, if a client experienced their therapist or counsellor to be warm, to be empathic, and to understand what they, the client, was saying, and if the client experienced the counsellor as being genuine, then Rogers argued counselling would work. This started the movement known as person-centred counselling or client-centred counselling, which put the client at the centre of the work, as opposed to some psychologist or psychiatrist theory at the centre, such as psychoanalysis. And this idea generated a lot of research. And some 13 years later, in 1969, two psychologists published a large-scale review of that evidence, and they essentially agreed with Rogers. Effective counselling and psychotherapy revolved around warmth, empathy, and genuineness. In fact, of course, later research has suggested that although in some cases this is enough, often more is needed. Usually it is helpful for the counsellor to provide some structure to the counselling, and usually it is helpful for the person being helped to be facilitated to think about how to make some of the changes that they would wish to make. So as I say, research has moved on since the 1950s and 60s and has enlarged on these ideas, and our core counselling competencies are based on this research. So first, we have divided up client-centred counselling into two key ideas. The first idea is that it is vital to listen to what an effective family member is saying. And listening here subsumes a whole host of individual skills. Yes, it means careful listening, but it also means active listening, hence encouraging the family member by how you respond to them. It means allowing and using silences as part of the encouragement. It means allowing the family member to express their emotions. It means providing positive encouragement and expressing hope and optimism that change is possible. The second key idea is the therapeutic relationship, and that is central to allowing effective change. The family member must feel comfortable talking with you, and that means you need to create with that family member a relationship that is warm, that is trusting, where they see you as being empathic and genuine, and where there is mutual respect. Now, the research on effective counselling over the past 65 plus years has demonstrated that these two sets of competencies, listening and relationship, are the most important sets of skills for a counsellor, irrespective of the intervention, irrespective of the theoretical orientation of that counselling. And research has also shown that some people are naturally good at demonstrating these things. Natural by virtue of their personalities and their values and the skills that they have acquired through living their lives. But research has also shown that these skills can be taught, that non-naturals can be trained to demonstrate these competencies. Some of that research is regularly summarized and updated by Drug and Alcohol Findings, an excellent website and resource whose mission is to bridge the divide between relevant research on interventions for drug and alcohol problems and the practitioners who provide these interventions. A good place to start is their treatment matrices, as shown on the slide. But research has gone further than that. And in fact, the 5-step method's core counselling competencies draw heavily on 3 areas of research. The most important is the area I've just outlined, client-centered work, showing that listening carefully and building a strong therapeutic relationship are absolute keys to effective work with people. The other 2 are counselling methods, which have each built up an extremely strong evidence base. And so we have incorporated ideas from both of these methods into our 5-step method. These other 2 sets of ideas are CBT, or cognitive behavioral therapy, and motivational interviewing. CBT emphasizes the relationship between what people do, their behavior, and what they think, their cognitions, conceptualizing that these 2 elements will have a major effect on people's emotions too. And motivational interviewing uses an explicitly client-centered style to help people explore and resolve ambivalence, which is a major area for effective family members when dealing with their relative with the alcohol or the drug or the gambling problem. So, from all of this, we get to the core counselling competencies within the 5-step method. We've incorporated all of these influences to create 5 core competencies, each of which involves the use of a number of different counselling skills. So 4 of these core competencies cover different aspects of building and maintaining a good relationship between the practitioner and the affected family member, and doing this in a way which aligns with a stress-strain coping support model, which means that a practitioner approaches the whole intervention in the correct way. And these 4 core competencies are creating a relationship of trust between the practitioner and the family member, facilitating the family member to talk with good use of listening, asking questions and probing, reflecting and summarizing, allowing the expression of emotions by the family member and making good use of silences, and offering positive encouragement, reassurance and support. The 5th core competency relates to risk and safety. Even though a practitioner should have undertaken a risk assessment prior to starting a 5-step method intervention, it's crucial that the practitioner checks the status with regard to risk and safety at each session, and indeed lets a family member know that they will be doing this. This needs checking because something may have changed between one session and another, or it may be that a family member feels better able later in an intervention to disclose something relevant which requires action. And of course, it's worth specifying what we mean by risk. Over the years, we've learned that risk needs to be viewed in quite broad terms and in relation to both the affected family member, of course, but also to other family members, including the using relative themselves. And of course, risk covers the key issues that can commonly arise in this work, particularly domestic violence and abuse and safeguarding issues in relation to children. However, it can also cover other things, such as the affected family member's own mental health and whether that is being placed at risk. And it goes without saying that all practitioners should know and be familiar with all the relevant procedures for managing issues of risk in their own organisation. And all practitioners should have access to a supervisor or a manager if issues arise which need resolution. And finally, in exactly the same way that we do with each of the steps in the 5-step method, we specify these core counselling competencies in detail so that practitioners can be clear about what is needed and can use this specification when they listen to their recordings to check that they have delivered their counselling to the best level possible. And these same competencies are assessed by assessors when a practitioner submits their recordings for accreditation. And the slide that you're seeing now outlines these 5 core competencies in more detail. And now we're going to move to a round table discussion where a small number of 5-step method practitioners or trainers or assessors will discuss both good practice and the use of these core counselling competencies, and also some of the common areas where the use of these competencies is not so good and what can be done about them.